cells, everybody. There's 5 types of white blood cells, and they are classified as granulocyte or agranulocyte. Granulocytes get their name because they look like they have little tiny grains inside the cells themselves. And 3 of these types, there's 5 types of white blood cells. The first one are called neutrophils. Neutrophils are basically going to be bilobes. So when you look at the nucleus, like over here, here's a neutrophil. The nucleus is going to appear bilobed. Now, neutrophils, you know, when they do a blood type here, or blood test, in a bacterial infection, neutrophils are going to be in great numbers. Neutrophils are already most numerous anyway, but they increase more in bacterial infections because they are phagocytes. They are going to go out and eat up bacteria. One line of defense here for our immune system. Eosinophils, they aren't phagocytes. You know, they're different white blood cells, kind of like these right over here. They're going to help us in fighting off infections of parasitic worms or even allergies. And basophils, basically popping up there with viruses, diabetes, and even in tissue damage here where you cut yourself, because basophils, most important thing about basophils is they secrete histamine, which is a chemical that's going to make blood vessels more permeable, so stuff leaks out of them easier. And they secrete heparin, which is a anticoagulant, helps thin your blood. Granulocytes, A means without, so these are without grains. You have lymphocytes. Anytime you got an immune response or responding to an infection or something along those lines here, you're going to have the lymphocytes increase in number. And there's several different kinds of lymphocytes. One type called a monocyte. You know, they have a large horseshoe-shaped nucleus, agranulocytes. Monocyte right here, the horseshoe-shaped nucleus. You're going to see a lot of these in case of viral infections, swelling, inflammation response. Now, the monocytes here, one more thing about them, monocytes will eventually grow into they're going to form into macrophages. They will mature into macrophages, which are going to be, they're going to basically pick up where the neutrophils leave off. You know, the neutrophils start fighting infections with being phagocytic, and once the monocytes differentiate into macrophage cells, they start picking up where the neutrophils start dying off. So you kind of view this as an army. The monocytes, where they differentiate into macrophages, are the replacement troops. The abnormalities, you guys have heard some of these already. Probably not this one. Leukopenia is basically a word we use for a low white blood cell count. And basically the number up there, I'm not going to test Shunt numbers, but generally 5,000 per microliter or less. Cause would come from radiation poisoning, infectious disease, or flat-out infection, some sort of poison. And the effects, if you have this, you are going to be at an increased risk of infections. So really remember, white blood cells, you know, white blood cells are disease fighters, so anytime you have a low count of those, you are going to be prone to infections. Leukocytosis, a high white blood cell count. And again, you might get that from an infection, allergy, or disease. Because your body is trying to fight off what it perceives as a threat. And that's where the differential count comes in. How to do a differential count. All right, you might have a high white blood cell count, but what percent are going to be granulocytes and which percent are agranulocytes? That's where the counts will come in. And when everybody is worried about leukemia, that's cancer of the hemopoietic tissue. Hemopoietic tissue, that's blood cell forming tissue that you find in the bone marrows and the marrow of the flat bones. Now the two types here, myeloid and lymphoid, both refer to uncontrolled white blood cell formation. Now the terms acute and chronic refer to, is this long-term, just going to be chronic, long-term, low problem, or acute, where it develops really fast. Acute would be bad because that's the one that for the onset to death is just a matter of months. Chronic might be several years. Now, why is this bad? Why was it bad to have all this extra white blood cells? Okay. When you have this many white blood cells all doing different things, they kind of counteract each other. So really what happens is you get a chance for opportunistic infections to set in. That should sound familiar because AIDS, attacks the T4 lymphocytes, which we'll get into later, and does the same thing. Makes you more prone to easy infections that should be fought off by your body, but they aren't. The white blood cells are fighting each other.